Manufactured in the United States by Pomadyne, Pertrach is an emergency cricothyrotomy or emergency and elective tracheostomy device that uses a patented splitting needle and dilator to perform a rapid and simple procedure in the most critical situations. The Pertrach is for use in hospital or pre-hospital settings when an airway cannot be established by normal means and you are faced with a can't ventilate, can't intubate situation. The Pertrach comes packaged in a sterile kit ready to use. The Pertrach kit includes one pre-assembled splitting needle and syringe, one backup splitting needle, one trachea tube, one dilator packaged in a protective sheath, one 5-inch extension tube, twill tape, and some kits contain an optional scalpel. The Pertrach is available in 5 different sizes, indexed according to the inner diameter of the tube. One adult size, 5.6 millimeter ID cuffed airway, and 4 pediatric sizes, 5 millimeter, 4 millimeter, 3.5 millimeter, and 3 millimeter uncuffed airways. To use the Pertrach, begin by opening the sterile packaging. Prior to using the Pertrach, read the printed instructions. Upon removing the Pertrach from the sterile package, test the integrity of the balloon cuff. Remove the splitting needle from the syringe and inflate the balloon cuff. Then deflate the cuff, making certain that air is completely evacuated from the cuff prior to use. Reassemble the splitting needle to the syringe. Remove the protective sheath from the dilator and insert the dilator into the trachea tube. According to your local protocol, you have purchased a Pertrach kit with or without a scalpel. If your Pertrach kit contains a scalpel, remove the protective sleeve from the scalpel. After stabilizing the neck, identify the cricothyroid. Make a small 1 centimeter vertical incision in the skin overlying the cricothyroid. If your Pertrach kit does not contain a scalpel, omit this step. With the syringe attached to the winged needle, remove the needle protective sheath and insert the needle at 90 degrees to the patient's airway. Bury the needle into the skin. A suggestion would be to clasp the needle between the thumb and index finger and advance the needle until it abuts the finger. Aspirate air to verify correct placement of the needle in the airway. Take care not to over-penetrate the trachea into the posterior wall or esophagus. Remove your fingers from the splitting needle. Angle the splitting needle and syringe 45 degrees or more and advance it towards the carina. Aspirate the Pertrach syringe again to verify correct placement in the airway. Remove the syringe and thread the trachea tube and dilator assembly into the needle until the taper on the dilator seats firmly into the needle hub. Squeeze the wings on the Pertrach splitting needle inward until the wings touch together and you hear a snap. You must then open the wings back up fully to complete the needle split. Remove the 2 halves of the Pertrach splitting needle, one at a time, carefully, making sure that you do not come in contact with the trachea tube. Apply moderate force to advance the tube and dilator assembly into the airway until the faceplate is against the skin. Remove the dilator and using the syringe provided, inflate the trachea cuff with 5 cc of air. Immediately begin ventilation and secure the Pertrach in place with twill tape. An optional 5-inch extension tube is provided in the Pertrach kit to use to extend the area between the trachea tube and the ventilation device. When using the Pertrach, the technique for a tracheostomy or cricothyroidotomy is identical. The only difference is the site of entry. For adults, the site of entry for the Pertrach is between the thyroid and the cricoid cartilages. For pediatrics, the site of entry for the Pertrach is between the 2nd and 5th tracheal rings. When using the Pertrach pediatric sizes, please follow the same direction for use, noting the site of entry is between the 2nd and 5th trachea rings. Please note that the adult Pertrach has a cuffed trach tube, while the 4 pediatric kits have an uncuffed trach tube. Training in the use of the Pertrach is recommended every 6 months for clinical personnel. Pertrach training supplies and materials are available for purchase. Please contact your local distributor for additional information. In summary, Pertrach is an emergency cricothyroidotomy or emergency and elective tracheostomy device that uses a patented splitting needle and a dilator to perform a rapid and simple procedure in the most critical situations. The Pertrach is for use in hospital or pre-hospital settings when an airway cannot be established by normal means and you are faced with a can't ventilate, can't intubate situation.